the analysis of the interview that I had. So my kind of analysis and approach to this assignment is a little bit different considering I already work in the social work field. I work in the medical department of the facility, but nonetheless, there are social workers, so I have decided to do a coworker of mine and her just approach to the company and that side of it. So let us get started. Just wanted to have that as a pre-notion before I start. So let us get started. Let me just share my screen and go from there. Okay. Okay, so as I said, this will be an analysis of just the presentation that I am going over and the research that I have come through and just found throughout the process of this assignment. So the description of the agency that I chose, as I said, it is where I work right now, and it is through True North Recovery and Wellness, and they are a facility that works towards opiate use disorder and treatment options such as methadone-assisted treatment, medicated assistance through prescriptions such as through buprenorphine and all that stuff, as well as individual counseling without medication assistance, which is a great option for people who are wanting that therapy aspect, who might have had addiction in the past, but just want that therapy component, as there are LCSWs and therapists like that part of the company as well. So the mission of True North is to help individuals dealing with addiction and just really be the best versions of themselves and just grow in the process of treatment. It is known that 5 times out of most people, they will actually relapse even when they're through the program. So it's really just good to maintain just that rapport with them and try to build that growth while they are part of treatment, as most of the time people may have that happen, which unfortunately within that modality of treatment and this type of treatment, it is likely that people could have that occur. So it's just important to just really have rapport in all fields, especially the social work aspect of the job. So who are the clients who use this agency? That's a great question. As I kind of stated, there's a broad variety of people, whether there be just counseling, people who are just wanting prescription-based just through the providers or just through the counselors. But I would say the majority of the patients who are there are people who are dependent and have a history of dependency on substances. And the majority as well are people who will be either coming into the clinic daily or twice a month or monthly, and these people are through the methadone-assisted treatment option of methadone treatment. And these really range in females and males, but more males than females, which kind of, when we were going through things, really is depicted, and I've seen in my own background too, with the question of just females in the field, which, to be honest, the research is quite, while I tried to find it, it is more male-based, as I just think there's more research to be done in terms of that. But clientele, just anyone who has any dependence. So the roles of the social worker, they honestly play a major role. From being an employee myself, my role as the nursing position is to assess the medical side of treatment. However, it's also important to see the needs if be of the other components, if that be social work and just other components of the patient to make a more interdisciplinary treatment option for that person. But the counseling role and the social workers do a lot of things. They partake in the intake process, so just getting to know the patients, getting that rapport with those patients, and the orientation process, which there is a packet and you just go through it and just try to make the clients understand how that process goes. Then, of course, you do your biopsychosocial, which all companies have, which I have been learning about myself through my class background and just kind of the formats that True North aligns with. And when I was going through my interview and stuff, it is very based off of just each clinician and what they want for the clients. And then, of course, another part of the role that these counselors do have is the discharging process. So when a patient or client wants to go to another clinic, that will be part of that, as well as just if they are going to be just leaving. And there could be many reasons. Crisis intervention, so if something happens that just happened in the moment and they're just going through something that they need more advice, the counselors are great to help intervene and really try to keep that client on that path of success with their treatment plan. Treatment plans, it's not stated, but it's one of the best things and one of the biggest roles of the counselors and social workers in this setting. The treatment plan is what they are working towards in terms of the success of the client and their goals for success in the program. So with that, you want to try to do advocacy work with the clients and just trying to advocate their needs and what they need, whether that be through housing resources, through just financial resources for maybe food. You really play the role of a counselor and caseworker through the position of the social worker in this type of setting when you meet with your clients, which is a very important role for that, as well as documentation and records. So you'll use the SNAP method a lot of the time, and you will also use there's so many DAP method. So you're going to want to use SNAP notes as well as the DAP. So that is data assessment and planning, and that's just how you align with the company's guidelines and just how you would assess the client after meeting with them. So views on the ethical behaviors of the client. One of the biggest things I learned when talking with the social worker was boundaries. Boundaries in this setting is very crucial as you get really, really close and you get to know your clients very, very well. And that could actually be a blurred line and just make it a little hard if they become a little bit more comfortable with you and just about your personal life and things about you. So you're just gonna really want to be that blank slate, which is another thing that the counselor and social worker mentioned to me. She just told me that it's important that a counselor be just blank, and even in terms of their office and their setting that they're in, just make sure it is a place that the client can feel like it's theirs and able to just be able to have transference and just be able to be successful. Salary is based off of experience. That just really depends on just how the client is and or how the employee is at that facility at True North. There's not much to that. So yeah. There is opportunities for advancement. I would say that through a company like True North, it is about experience based, and just with it being a smaller company, what I kind of inferred is growth is where advancement happens in terms of opportunities. And yeah, it's just through the growth of the company and just working with the company and growing with it, honestly, for a smaller independent company, which is where the success comes. With that being said, the job satisfaction is really good as it's smaller. You get to know each of your coworkers and just what makes everything work, which is just great. And overall, the success is really good and a healthy environment. When I did speak with the director, social worker, we did kind of go over the idea that a healthy environment and not having kind of a person in the field of social work that has low self-esteem, low confidence, that can affect the overall well-being of the company and success of how healthy the just overall employee environment is. So here is the organizational chart. It has just a group of people. So there's that. And then, so the applicability of social work is very applicable to the field, and just how working in the field of social work can really apply to the field of social work in all aspects, and just how you can really use a lot of academic skills when you're in the field, as well as being one that learning on the job can be very, very beneficial to the individuals who end up being in this field of social work. So my concluding thoughts is, while I wanted to really dive deeper in the idea of social work and methadone treatment with women, it's really, really closely knit one-on-one with male and female in that. And I learned that it's a very effective modality of treatment for people who have opiate use disorders. Of course, there's a greater male over female. I think that just comes with the company being smaller and that aspect. How personal boundaries and burnout can happen just from that lack of rapport or just too much sharing. And honestly, without collaboration and teamwork and just from everyone, it can affect just the whole being. And just that social workers are a key component to the treatment options and plan of this type of facility. So that is it. So thank you so much. And yeah, thank you for listening to my presentation.